eminent co-panelist is understand healthcare, not disease care. We have been taking care of disease more than health until now. And that is where we lost most of our battle. India became diabetes capital, and all the attributes given to us as a brand is not what we deserve. What we deserve today is we are the first country in the world to provide COVID testing solution at masses. We were the first exporters across the world. We became the one of the first countries to produce largest number of vaccines wherein they were developed in this part of the world. And we became the exporter from a consumer. What we are trying to achieve today, we are trying to achieve a status in the world where we don't just become the consumer market, but a market full of sense, understanding, and reliability in terms of our growth. So I would start today with the guy on my rightmost. He is a man whom you don't know by face but know by brand called Practo. How many of you know Practo? Perfect. So we all know these guys started a very beautiful brand, which led to a situation where find a doctor on your computer, connect with a doctor, get your bookings done. But now, as I was talking to him in backstage, they are now into research-based evolution to understand disease, its mechanics, understanding it, taking it to the next level, making it available to people. Technology is only a technology when it is utilizable. And that is what practice is trying to now do in healthcare. Again, it's a healthcare, not disease care. Then on my next, to my right, is the man who leads India's biggest healthcare system, NHA. We all know NHA, so there is no extra definition required to this brand because we all are part of NHA. If you are a private or a public sector operating in India for healthcare, you are part of NHA and the guidelines. So he would help us to understand the basic changes that government of India has made over the past 6 months, 1 year, to make us look the leader in the world. And to start with you, Anubhav, as your name is also Anubhav Experience, what is the experience in telemedicine? Do you think it's going to stay as our introduction with telemedicine only?
Thank you. Just a small correction. Abhinav, it
Sorry,
happens
my
quite
bad.
often. It happens quite often. So telemedicine, I if you really look at the telemedicine, and we actually launched telemedicine in 2016, um, has actually growing at a very fast pace still, right? It's growing at about 30% every year, CAGR, and is supposed to reach a 5 billion industry in the next 5 years. Um, the telemedicine, when you actually think about it from a consumer perspective, and when we spent a lot of time talking to consumers, what we realize is the first experience which was the hurdle, right? So if you have never experienced telemedicine, it's very difficult to really understand how effective it can be in certain cases. And of course, COVID kind of forced a lot of consumers to actually experience it for the first time. All right. And we saw within the Practo platform, we actually saw almost 5x growth in telemedicine during the peak of COVID. And specifically in tier 2 and tier 3 cities, we actually saw almost 7 to 8x growth. Um, Even though the numbers have actually come down since COVID, the baseline has actually moved, right? So if you look at pre 2020, where we are still significantly higher than that. And more consumers are actually utilizing it. And these are specific use cases where telemedicine actually fits in a lot better. So when we look at our platform and our data, we see a lot more teleconsultation happens late in night and early in morning, where the availability of doctors and actually being able to visit them is difficult. We actually see 3x higher demand on Sundays than on most days, where again the availability of doctors is actually lower in most of the places. So that's kind of one area where we're seeing telemedicine actually finding its niche and seeing a lot of growth. Second is, of course, if you look at the doctor to patient ratio in India, even though at a higher level, right, when you average it out, you say it's low, but when you de-average it out and you start looking at each cohort, right? So if you look at the top 5, 6 cities in India, our actually doctor to patient ratio is fairly well, right? It's almost on par with global standard. You go to the next 30 cities, it's kind of drops and almost becomes half. But the moment you go beyond that, right, that number actually drops very sharply. And then there is availability of specialists, availability, right? And we have seen that that's the cohort of users, right? The accessibility part of doctor is where we are seeing more and more growth and more traction, right? Because there are consumers who have to actually travel 50, 100 kilometers to actually meet a specialist, right? Whereas the smartphone and 4G and 5G in India has actually made inroad to all these places. So we were actually having a discussion internally, and the team was actually showing me this data a couple of weeks back, right, where they have mapped out a pin on Google's map of every location where telemedicine happens, and today we see it covers the whole country, from north to south, east to west. Every single small town, village, we have consumers who have come on the platform and done it. And the third area where we are seeing a lot of traction, there are certain speciality where there is still a stigma of actually visiting doctors personally, right? Whether it's sexual health, mental health, that these are the specialization we are seeing actually significantly higher growth in telemedicine, because consumers are a lot more comfortable being able to actually connect to doctors and have that privacy and things. So we really think that telemedicine will keep seeing the growth given the context of India, given our population, given the accessibility and quality.
Uh, Abhinav, I have one question connected to this because you have really triggered a very important part. So, when you say privacy is taken care in mental and sexual health, what people really are shy of talking, I don't think many people go to a pharmacy and talk. I want this flavor of condom. You just feel so shy that whatever is the first box you carry and come back. So you understand that telemedicine is solving that first barrier of communication when you can communicate. How do you ensure privacy over there as practo?
Uh, so in context of telemedicine, right? So there are different level of privacy, and the first thing and foremost is actually people are very uncomfortable visiting. So if you actually have a mental health clinic or a sexual health clinic, right? People are just afraid going there, because when you walk into it, you are afraid that okay, somebody I know is going to see me walking in, what they're going to think. So that's kind of gives you the first level of privacy. You can open your phone, talk to a doctor without having to actually visit, which kind of gives you the first. And second is, of course, we allow on our platform, and we've seen that specifically we support both text-based consultation and we support video-based consultation. And we see that text-based consultation actually in these specialization is used higher, because then you don't really have to go on a video call. So you actually add another layer of privacy, saying that as a patient, I can just start with text and I'm not really exposing myself in the consultation, right? You can get the comfort. And of course, from a technology perspective, we kind of ensure that it's end-to-end encrypted, the data is encrypted, and we ensure that the privacy of the patient is actually maintained.
And you also ensure it's a real patient, not somebody trying to introduce himself as a patient. So on that note, because then it comes a lot of ethical things would come into play when there's a big data being churned, whether we are dealing with patients in a hospital or whether we are dealing patients in silico on an online platform. So my question to Mr. Narendra to you would be, because NHA is right now trying to draft the country in a way where data can be captured, the patient should be the owner of his own or her own data. What are the ethical challenges? Because if the barriers are to be defined, the growth stops when the barriers come up, and there is a fine line which defines ethical line versus the growth line. How do we define it at NHS?
Yeah, thanks for bringing the thing about data. See, the data which we create, I mean, when you go to a doctor and all the reports which are there, so till ABDM or NHA came into play, every time the data was supposed to be the hospital data. The hospital was supposedly the owner. If I went to a hospital, I had a surgery done, they will give you one copy of the report. But suppose you lose it and you want it in future, then you have to go through a whole process of going to the doctor, getting the approval, then some admin person. So the hospital became the owner of the data, which actually was your own data. So where now after the ABDM, the whole concept that we started was that the patient is actually the owner of the data. So when I go to a hospital, if a digital record is created, I can pull it on my mobile through a PHR app. So a lot of apps which are already there in the market, which are EBDM enabled, you can pull the data. And again, If I go to some other place, if a doctor is requiring the data, they can request for it, but then consent has to be the whole consent framework. Then you see in the DPDP Act, which has just come up, that the data belongs. There's a fiduciary. If you are a hospital, you're just a data fiduciary. You're just keeping the data on behalf of the patient. Uh, so that's the whole concept that ABDM has brought in. And if it has to be, floating around, it has to go to someone. If I'm the owner, I can give it to anyone. So a lot of researchers use data. They use anonymized data, but then for anonymization to happen, someone has to give the data. And for that to happen, the patient consent is not taken. That is something which ABDM is bringing into play. So uh, I think that I hope I answered the question. But I just want to add to one thing which Abhinav was talking about. Growth of telemedicine. So I think it is something which will grow because see, one thing which ABDM also realized that currently the telemedicine growth is all platform driven. So there are the platform which Practo has. There are other companies which are there in the market. So the doctors are there, and if you have that app, you take the services. But what we have been doing is we have brought in a concept called UHI, which is called Universal Health Interface. So if you are using any app which is a UHI enabled, and there are doctors which are on the various platforms, so you can search for the doctors. See, currently, as you see, you want to pay someone through a QR code on the Paytm. You don't bother whether GPay or using Phone Pay or any other system. You just scan the QR code and the payment goes to that person. So similarly, what will happen? There are platforms like Practo, there are other platforms. They have their own doctors, but those doctors, the availability till now was limited to the people who are using those platform end user thing. So what we are trying to do is at the end user application can be anything. You can search for an availability of a doctor at any point of time. I think that will lead to the growth. Apart from private sector, the government sector is also doing a lot of telemedicine. The e-Sanjeevani system does around 3 to 4 lakh consultations daily. So I think telemedicine is something which will grow, as you were saying, because the availability of doctor to patient ratio is very poor in the country.
Yeah, I remember in the early 2008, government has started with a couple of private players utilizing VSATs across the country, programs where telemedicine was one of the important services to be rendered through village level entrepreneurship. They were called VLEs, and Sulabh centers were started. I remember 6,000 plus centers were there. I was fortunate to be part of the designing of concept at that point in time. So I fully agree with you. Government has its own style, but when it comes to telemedicine, in the same sequence, a word comes to my head is wearable devices, and I think in India there is a fetish for wearable device. Now people have got two watches: one the smart watch, one the regular watch. If you are wearing regular watch, then you will still wear a band in your hand. Uh, who is going to decide on the quality of these devices, and how are these devices changing the healthcare practice today, keeping people healthy and away from doctors, or giving the indicators to go to a doctor before they feel it physiologically? So what is your take on that, Abhinav?
Yeah. Actually, if you think about it, and then that's the thing, the growth, right? So just to give you an idea, the fitness band, actually the whole market grew by 144% last year. So kind of gives you a sense of how fast that is growing. At Practo, we actually follow a philosophy says what gets measured improves, and I think that's kind of the underlying thing which is going to govern the kind of impact these devices are going to have. So if you really think about it, there are two fundamental things are happening. One, there are more devices which allows you to measure real-time data is coming into picture. So if I go 10 years back, we started with a step counter, right? So if you remember the first generation of fitness bands, the only thing that they supported was step counting. Then we added heart rate monitor, then we added temperature sensor, and we're seeing more and more sensors actually getting added to the device, and more things of real-time data is being able to be created. And the second trend that is happening, which is actually effectively the cost of these devices are coming down dramatically. So if you think about first generation of smartwatches, which Apple and Google's of the world, they were extremely expensive devices, right? 40,000, 50,000 is what you require. Today, you can actually buy a smartwatch for 1,500 rupees, right? Which actually has more or less the same functionality. Definitely, we need a little more governance into the efficacies and accuracy of the data that is being measured. But we will see a lot more devices to come into picture. So one of the example that I want to talk about today is actually CGM, which is continuous glucose monitors, right? This is a device which has been there for now almost a decade, but finally it has reached the point where the cost has come down significantly. So even though it used to be $1,000 when it actually came about, today you can actually buy a CGM device for almost 2,000 rupees, right? So significant drop in cost. But what it gives a real-time view into the glucose reading of your body, right? So India, you actually talked about it. Now we have a lot of people now with chronic conditions, especially diabetes, more than 100 million people. And what we are seeing is that when you actually combine this real-time data with coaching, right? So we actually launched a program earlier this year called Practo Transform, which actually takes the CGM device, puts it on the patient with diabetes. We combine it with a doctor, a nutritionist, a fitness coach, and a psychologist to help you change your behavior, right? And we just finished the first 500 patients who have gone through this program, right? And we have seen 88% of the patient actually either have reduced their medication or come out of medication completely, right? So gone into remission. The average HbA1c has come down from 8.4 to 6.6, right? And on average, patients have actually lost almost 7.5 kgs of weight in the 6 months program. And that's the kind of impact you can have. And the biggest difference from a program, similar program existed even before and now, the biggest difference is that once you put the CGM, the patient and the care team has insight, real-time insight into the data of what's happening with the glucose. So every time you have a meal, I can actually see the kind of impact it had on your glucose, what works for you, what doesn't work for you, and make sure that you are management.
So my question to you would be, Narendraji, that as there is a lot of data getting created and a lot of devices are also getting into the market today. So if I see in 1999 when we were kids versus in 2023, every kid has a device. When we were kids, only parents used to have a device. Now every kid has his own device, and data is being generated in one or another way, which is scattered and also is captured by a couple of players but not by most of the players, and it's not getting into a pattern where a derivative can be a solution and keep the healthcare more safe. So as NHA, is there anything where the device manufacturers can connect with NHA and create a data pool and subsets further down the line, which leads to precision medicine, or individualized medicine, which is what the world is always trying to talk about. That how can we treat cancer? How can we escape from heart failures, which are happening now? So many celebrities lost their life when we had news around people dying on the treadmill, and there was a certain cardiac arrest, and they were healthy before. So these Fitbit fitness bands could not create any alarm over there, and there was a data already with, because these guys had one of the most reliable fitness bands with them. So do you think NHA should intervene now and create a subset or a place where these guys can come and become part of the national health?
Uh, See, NHA per se, we are not looking at collection of data. So what we say the data where resides wherever it says, and it's a federated architecture, what we call. But yeah, we are looking at concept of health data management. So we came out with a consultation paper some time back, and we are working on it. We got feedback, and uh, this is something which will grow. Currently, the concept of the data being there, digital data in this country is not so much. If you go to many places, like see today we link the digital records which are getting created to some ABA numbers. So we have around close to 50 crore ABA numbers right now, but we have only around 32 crore records. So let every person who has an ABA record is not linked. So there is a lack of usable data. So sometimes, I was talking to someone, they say, our digital record is, if you go to a doctor, the doctor writes paper, prescription on a piece of paper, we scan it and we keep it. So that was the kind of digital, digital signature some time back was a You sign on a piece of paper, you copy it and you scan it too. So that's the kind of thing. So we are growing that path, and the framework is there, but it is the whole thing will take some time. And the
Because we have been part of ABDM journey from very early days, and when we started Practo about 15 years back, that was one of our vision that eventually we will actually collate all this data, and for every patient there will be a single identity. But over the years we realized for a single private player it's very difficult to do it, right? So we are very happy that NHA has taken that mantle up, right? And the progress we have seen over the last 3 to 4 years has been phenomenal, right? 50 crores Aadhaar number, and I know 32 crores health record is still some distance to go, but the early signs are there. If you compare it to something like UPI actually from 2015 to 2017 kind of was building up, and in 2017 is when the explosion happened. So our hope is that the great framework that NHA has created will actually allow us to keep expanding, and over the next 5-10 years we will see all of it data being actually owned by patient, which is the most fundamental concept, the groundbreaking concept, which is actually not there in a lot of country. The patient has the full ownership on data, and also they control who can access that data, which is actually
Yeah.
very empowering.
add on the usage of data. I mean, I was just talking to one of my colleagues in NHA some time back. He said one of the insurance companies where he was buying a health insurance, they actually asked for the access to his Fitbit data, and they gave him a discount after that. So, see, the usage of data, as you said, it's not when you go to buy insurance policy, they'll ask you what are the medicines you have taken, what are the surgeries you had. But now they're also looking at the wellness data. So, the usage of data will coming over a period of time. And one thing which I have started, recently also, which will lead to the growth of digital data being, I think, being used, being created, is the health claims exchange that government NHA has recently launched. So what will happen? See, currently, if you go to a hospital and you have a health insurance policy, you would give, you'll give a paper of the health insurance policy. They'll do some pre-auth, and the last day of discharge at 8 o'clock, the doctor will come and tell you, okay, you can go home. Everything is fine. After that, you spend next 6 to 8 hours. Something will send from the hospital to the insurance agency, then it comes back. You spend around 8 to 10 hours. Around if you leave your hospital at 4 o'clock, you are one of the lucky ones. So after this health claim exchange that we are talking of, there's a digital exchange of data between the hospital and the insurance company. We are coming up with a common platform. A lot of insurance companies are already in touch with them. They have developed a POC. Soon will be maybe launching in some soon. So after that, this data will also see the use of this data will also lead to less fraudulent claims in the industry. Maybe percolation of this health insurance policies to the tier two cities, because a lot of tier two cities people don't buy insurance policy because there's no cashless facility in the all those hospitals. And if you have to spend money and then you have to go for the reimbursement cycle of 6 to 8 months, you might as well do it. So that will grow. And so, as I said, first we have to look if the data is getting created, then the use cases for the data, and looking at the I look at the healthcare industry that there are a lot of things we spend a lot of time which are not health related. If you go to a hospital, a lot of things which the doctors spend time are not related to the patient care. They'll be looking after some administration work, they'll be looking at some other things, and all that can be done digitally. So I think that is something which will.
Yeah, I fully agree with you, because we have experience across just not our country, but also we are integrated with a lot of healthcare operators back in Australia, and we have been operational for more than 8 years, probably dealing with more than 500,000 patients year on year. What we have realized that the healthcare data structuring is probably the only answer towards precision medicine, towards preventive care, keeping healthcare, pharmaceuticals, and diagnostic system innovated and upgraded. Because data is the key. If you have data of a person who actually can understand why I am sick versus my son is not and my father was not, from the same type of disorder which is considered genetic, because genes don't express in same family even. So understanding that personal basis is only possible when people who are sitting in this room, including us, go for a genomic mapping. We would never go for. We would say, why do I need my forefathers never went for it? So the not just the structuring of data, but also the data generation points in India needs to be redone. We need to, I think, work on the points where we are very exceptionally ready to get ourselves mapped. Genome sequencing was done long back. And do you know the father of medicine, Hippocrates, he spoke in 425 before Christ, BC, that don't look at the patient who is carrying the disease. Look at the disease who is carrying that patient. And if you understand that patient before the disease, you can cure him better. Imagine he was talking about not personalized medicine, he was talking about individualized medicine before Christ. So, what we're trying to do today in precision medicine is nothing different. It's all about understanding you through your data points. When you understand that, like you do that glucose monitoring, now we know at Practo, what you're doing, you are understanding that person's diabetes, whether he is pre-diabetic, he's not diabetic, he's going to be diabetic, his eating habit, and this sugar surge response of the body 24/7, and then you craft a journey of health for him, not a disease for him. And I think if we, as an industry and individuals, understand the value, probably the achievement would be health. I say probably because health is a big topic and it's not that small that you can just achieve it by having three people for 45 minutes. It requires 300,000 people for 45 years to build something called healthcare system. But what I realize is, as you rightly said, the data is coming in. The data is coming at your end also. We are not pro towards creating meaningful data. And if every one of us takes a pledge, goes back home, and wants to be healthy and creates the healthy data and utilizes it as the owner of his own data for his own benefit, but gives 10% of it to the society as information which helps the pharmaceuticals and the testing bodies to create better regimen to keep you away from the hospital, I think the transformation of healthcare will happen. And to have that, we have to upskill our people. We'll have to train them. We'll have to train our doctors, map artificial intelligence, have to get best of the metaverses to get them best of the surgery practice so that our rural doctors can also do surgeries on trauma patients. You never know when somebody falls from the bike, when somebody from some tree, or even in the bathroom. So if you carry the patient for 200 kilometers for surgery, even if he has a trauma, you're going to lose him on the way. The paramedic has to be trained to pick the patient properly, give the support properly. You have to be trained to give CPR to someone. If you are visiting Taj Mahal and your father has a heart attack, you're not waiting for a doctor. You give the CPR then and there. And I think this is all coming from a single thing. Before buying a wearable, understand why you have bought a wearable, where the data is going to help you, and how these people who are sitting here, obviously you understand these people make their own work by completing their job, but actually the work is to get healthcare to you. So Abhinav, last line that I want to know from you would be, if you are not from Practo, you are just a techie, what would be the change in technology you would like to bring in today's post-COVID, which is, after COVID, we say before COVID BC and after COVID nowadays, a new BC has arrived. So what happens after COVID, Abhinav's style of starting a venture which can secure healthcare for India?
It's a very interesting question, right? If you really think about the history of healthcare, right? Um, we have actually kind of approached it as, and when we think about it internally, and personally myself, we have actually approached it as symptom suppression, right? That is what most of the healthcare has been historically, which has been great, right? We have changed the course of human history in the last 100 years by actually changing life expectancy in leaps and bounds, child mortality, a lot of diseases, polio, like TB. We have eradicated a lot of that, right? But what has also happened is in the human history in the last 100 years, this is the first time. If you look at long human history, it's a tiny portion in which people are living this long, right? So there is a lot of new diseases which we were not aware of, right? If human life expectancy was 40 years, most of the diseases which were not there so prevalent as suddenly becoming prevalent, and are actually being new diseases which were not there so prevalent are suddenly becoming prevalent because people are actually living for that longer. And a lot of these diseases are actually a function of a combination of a lot of things. So the new diseases actually you need to approach it in a more holistic way, right? It's a combination of fitness, wellness, mental health, and proactive healthcare. And if I really have to start there, that would I will bring to the thing of how do you really manage that.
I have very important question for you because you represent government of India on this stage. What is government's take on keeping and making sure, because our prime minister always talks about healthier India. He's talking about preventive care. As NHA, what would be the first step that you think today on this day on 24th of November we should be talking about, not the past. What we have done is great. What we have achieved is supremely appreciated across the world.
There's no one single short solution to health per se, but as Abhinav was telling, see, we are more reactive. See, we were treating a symptom, and then all solutions are till such time you'll do a research because you identify there's a problem, and then you say we'll find a solution. Even COVID was based on that. But now the thing is that we are going from a health to the wellness concept altogether. So that's where what we are promoting. When government of India is promoting yoga and all those things, exercise, Khelo India jab bhi jeetega. So all those things are uh, things. You see, it's not related to a doctor prescribing you things. It's related to overall the way we live. So if we live the way, if we are talking about healthness, so I would not say National Health Authority will tell you, you take your medicine on time, you do all this, and you'll be well. It's like the way you live. That's something which, as a society, we have to change. It's not something which it can be a prescriptive thing that government of India will tell you that every day you get up at 6 o'clock, take 1 hour, 30 minutes of walk, then you go back, then you go back home, and you sleep at 11 o'clock. So it's not something which as a society we need to understand. And I think we have post COVID, a lot of us have understood. That's why I think the wearable devices growth has grown up in that age itself. So that's my take on it.
I think, one line which is very consistent among all of us is health is not something which can be spoken in one day or one moment. This is all what we have created over years. And this has been happening when there was nothing before Christ. Hippocrates was there. He must be having a technology which was talking about individual care, and which is what we are talking today in precision medicine, individualized medicine, super customized medicine. What we are trying to achieve? We are trying to achieve health, not disease. We don't want people to go to hospitals. We want you to be at home more. And so, all these initiatives, whether understanding you and your body, getting your diet better, understanding your lifestyle is your responsibility, not government of India's. Don't go and curse government if you meet an accident because you're not wearing a helmet. So these are, I think, some of the very big measures as healthcare service providers. We believe what others country have done on their smaller population. India is super advanced country. We in every e-rickshaw see a rickshaw driver having a YouTube video playing when he is not having the passenger, right? And he's talking about his favorite list automatically comes from Google, what he's watching. So if he can have his music fine tuned, we can have our health also. And we can do it with people like, people on the dais and who are not here. And there are millions of healthcare providers who are not today here working for our health, not your health, our health, keeping ourselves healthy. So I wish you all the people a great healthy life. And thank you for being such a patient audience. Would like to see you sometimes in some other part of the country and world. Thank you so much.
Well, thank you so much to our speakers. Thank you for sharing a wide range of perspectives on telemedicine, importance of mental health, and thank you, sir, for leading that conversation. Will you please come together for a group photograph? Thank you once again. And now, like I had said, that we had some amazing discussions since morning. We had a special address. We then pivoted to healthcare, and it's now time